From Christy Brinkley on keeping yourself safe in the sun are just the tip of the iceberg. Dermatology leaders in America are joining her to warn those who worship the sun that they need to be careful. They're releasing new information about skin cancer and cancer screenings in Washington later today. Joining us now are Dr. Bruce Robinson, a dermatologist with the Advanced Dermatology Group. Welcome to News 12, Dr. Robinson. Are we just hearing more about it, or is there truly an increase in the incidence of skin cancer in America?
Unfortunately, absolutely. There's a dramatic increase in skin cancer right now in the United States. The American Academy of Dermatology projects that there's going to be over 1 million skin cancers diagnosed this year.
And the reason for this?
Basically, families that have grown up in the past have not really been counseled in the proper use of sunscreen and not heeded the warnings of dermatologists to really stay out of the sun. Only 2 out of 5 people really apply sunscreens regularly, and only 1 out of 3 use the proper SPF.
Now, many skin cancers are imminently treatable, but there are some forms of melanoma that are not especially treatable and are quite fatal. Are those on the increase as well?
Absolutely. There'll be 32,000 melanomas projected to be diagnosed this year, and unfortunately, 3/4 of all the skin deaths related to skin cancer are due to melanoma.
There was a recent study that actually made it look as though that the sunscreens could worsen the problem. Was there any validity to that at all?
Well, there was a article in the Journal of the National Cancer Institute that did say that since the sunscreens do protect you from ultraviolet B rays, which are the warming rays of the sun, that you would be tending to stay out in the sun longer and possibly promote your risk of melanoma. It was a study done in mice, but there were some flaws, I shouldn't say flaws in that study, but this was a melanoma strain that was not similar to the one in humans, and they only used an SPF of 8 or less.
Okay, how much and how should people apply sunscreen?
That's a very good question. There's some very good sun-safe tips. You should always use an SPF 15 or greater and apply that approximately a half an hour before going out into the sun. You want to make sure that you use the proper clothing, which is a hat with a brim, maybe some tight knit clothing. In addition to that, you want to make sure that you use ultraviolet protected sunglasses. And please, 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 if you can plan your activities in the shade, and also avoid tanning parlors.
And this also affects people with darker pigmentation.
Absolutely. Nobody is immune to skin cancer.
Now, what's going on in some of the tropical climates, some of the so-called third world countries where people are spending enormous amounts of time out there? Can we expect to hear some rather frightening statistics down the road?
I think that's a very good possibility. A lot of the third world countries do have genders of people who are in the darker skin category, but there is some frightening statistics, I think, on the horizon.
Is there anything we should do other than just stay inside a lot more? Is sunscreen and hats, are they the only answer?
Really, we need a sun-safe strategy, and that's very important. And the Academy of Dermatology has planned that through professional and public education, and as well as skin cancer screening. The month of May has been designated the month in which we do have skin cancer screenings, and we expect over 100,000 people this year to be screened free of charge, and we do emphasize that people do that. So using the sun-safe strategy of staying out of the sun and using sunscreens, as well as checking yourself yearly, will really help alleviate the problem, because this is the most preventable cancer known to medicine.
Now, when these screenings are set up, when are we going to know where they are, when they are?
You can always contact your community hospital, or if you'd like, your local dermatology office, and they will be able to tell you.
Okay, thank you very much, Dr.
Thank you very much.
Robinson.